Thank you very much. Thank you very much for the invitation. I'm very happy to be in Croatia. We go from Italy to Spain, from Croatia, so Mediterranean countries. I will go directly to some things, not to repeat everything, because maybe, well, we have same problems in different countries. Well, you know where we are, and we also have problems like in Italy, because we have several regions. And in each region, they develop their own economic and sanitary way. Yeah? So we have several different organizations in each of these regions. So we are almost 50 million people in Spain, but about 60% of the population is in Madrid, Catalonia, Valencia, and Andalusia. Andalusia in the south of Spain has more than 8 million people. It's a huge region, but for example, Madrid has more than 7 million people, and it's a very concentrated population. Yeah, it's a small region, but it has the difficulties of the big cities that do not, the transportations sometimes are not that easy. So each region is different, and you can see that some regions like Extremadura in the west or Aragon are really very, very, very vast, very wide, and they have very few population. So these are the numbers of the thrombectomies done in Spain in each year. We started in 2015 with more than 2,000, and in 2023 we did more than 8,000. I can tell you now that we are registering the cases of 2024, but we have more than 9,000 thrombectomies. So we can say that in these 10 years, we have done about 60,000 thrombectomies. But the important thing is not how many thrombectomies are we doing, so which population has a benefit for this treatment. And maybe this is much more important, the thrombectomies by 10,000 inhabitants. So we started in 2015 with 4.6, and in 2023 we reached 18 thrombectomies by 100,000 inhabitants. This year, 2024, we are going to pass in the 19. But in each region is different also, because each region has also different incidence of thrombectomies. And in the north of Spain, for example, in Cantabria, in Asturias, there are more strokes than in other regions, like in the southeast. There are some things like the food, maybe, and some other things that make a huge difference. Andalusia has done more than 1,600 thrombectomies, for example. And you can see the neurointerventionalists that we have by region. And there are also big difference. In Madrid, we have 29 physicians doing a stroke. In Catalonia, 25. In Andalusia, 18. And there are some places like Baleares, Ibiza, Mallorca. In these islands, there are only 2. Now there are 3 physicians doing a stroke. Yeah, so this is a big change between the regions. So if we see the same for the thrombectomies by inhabitants and by region, so you can see that there are very big differences. We have in Cantabria, in the north of Spain, 38. Yeah? So, and in Valencia, in the east, we have 13. I'm sure that there are some difference because of the food or because of the incidence of stroke, but there are also big difference because of the organization in each of the regions. Cantabria, for example, has only one hospital, and it's a small region, and every stroke goes to the same hospital. And in Valencia, there are 3-4 hospitals doing a stroke. We have 51 comprehensive stroke centers, including some private, but very, very small ones. And this is the organization. We have 8 comprehensive stroke centers in Madrid, for example. There are 6 in Catalonia. So as you can see, most of the regions have a comprehensive stroke center, but some regions don't have, yeah? And this is a problem because they have to go to another region. And there are also big differences between the hospitals. These are the thrombectomies done in 2023 in each of the hospitals. And you can see that we have the big one is Sevilla. It's the only stroke center for the whole of Sevilla and Huelva. This is a region that is beside Sevilla. And they did more than 500 strokes last year. But most of the hospitals are between 150 and 250 strokes. I think it's a good number for the organization. Yeah. Most of the centers in Spain are public. We have few centers doing private, and they do very, very few strokes too. Well, this is the Spanish Society of Interventional Neuroradiology, GENI, and yes, we started in 1994. There were just 25 physicians starting to do this. The first treatments for stroke were done also in the late 90s. And now we are more than 200, yeah? So things have changed a lot. Within almost 200 is a big change, but the numbers of the strokes and treatments are much higher. So we have the same problem about lack of physicians. Yeah, most of the centers have between 3 and 5 physicians. There are some centers that only have 2. And dedication to this field, almost complete, is for 3/4 of the physicians. The other ones have to do some other works, like diagnostic most of the time. The middle age that we have in Spain of the physicians are 44 years old, but we have almost 10% of the physicians with more than 60 years old. Yeah, from 25 years old, we can stop to do officially. We could stop to do on calls. So this is important because yes, we think that maybe only 80% of the physicians can do a stroke on call. Yeah. But it's not true because they still are doing a stroke on calls, yeah? Because we have lack of physicians, and if we are 3 in a hospital and one of us is not going to do calls, yeah, it's going to be a big problem. So they keep doing strokes. So we ask to our society the need for hiring staff. And you can see that almost everyone need to hire. And the projection of the retirements in the next 12 months is about 20%. So this is a challenge for us, and I think maybe it's the same in the whole of Europe. We are mostly all radiologists. There are some neurologists. Some of them are radiologists also. Yes, there is only one neurosurgeon, but we have more and more interest from neurologists and neurosurgeons to do interventional. And we have 118 angio rooms in Spain. It's true that half of them are shared with other fields, interventional radiologists, most of the cases. But we have 49 angio rooms exclusively for neuro, and even 11 hospitals have 2 angio rooms in exclusive for neuro. I think this is another problem that we have everywhere, that we have to share angios, and it's not easy when we have a stroke and more in the mornings, and every angio room is busy. What about the technique? We ask for this also. We have a registry for that in our society, and yes, 50% of this is the first option for each center. And in 50% of the centers, their first option is the combined technique. This is still 20% that are doing stent retriever as the first line, and 30% doing as first line adaptive aspiration. But this is changing, and we have more aspiration centers each time. And the balloon catheter, yes, is used in about 30% of the centers. And stenting, maybe this is we are doing stenting in about 3% of the thrombectomies, intracranial stenting, and for extracranial stenting in about 11% of the centers of the strokes. The preferred anesthesia is general anesthesia in about 44% of the centers, and 36% for sedation, and 20% for local anesthesia. Mostly of the centers have an anesthesiologist in the angio room, but not all of them. So in conclusions, I think we are proud in Spain for the rapid adaptation of the technique, but we know that it has been done with a personal and professional commitment of the interventionalist. There's a rapid extension of the application of the treatment to the majority of the population. But all this in spite of lack of professionals, unlimited working and economic conditions, I can tell that also. And we have challenges ahead for the extension of the technique to more isolated and bordering regions. In some places that are in the border of 2 regions, sometimes it's difficult where to transport the patient. And also for the training of new specialists. I don't know if it's your case, but it's true that we have problems with the young generations, that they have a lot of work doing diagnostic, and they earn much money, and they don't want to change their lives to do stroke calls. Thank you very much, and hope to see you in Spain also.